Welcome to another Journal Club session. I hope you enjoyed last month's topic that looked at experiences of pediatric nurses in nursing dying children. If you missed it, don't worry. You can always access it through the YouTube channel. Are you watching this alone, or have you gathered a group of colleagues to watch it with you? If you are alone today, maybe consider watching with colleagues next time. You can access a guide how to organize colleagues watching together in the description section below. This month's article is titled CLABSI Reduction Using Evidence-Based Interventions and Nurse Empowerment, a Quality Improvement Initiative from a tertiary care NICU in Pakistan. It was written by Hussain et al. And published in the journal Archives of Disease in Childhood in 2021. Let's first look at the graphic summary of the article. This graphic breaks down the different sections of the article and provides a visual summary. In this video, we will now unpack each section. If you have a copy of the article with you, you could track the sections of the article as I speak. We start with the introduction that you can find on the first page of the article. Central line-associated bloodstream infections, or CLABSI for short, are the most common hospital-acquired infection in neonatal intensive care units. The negative consequences of CLABSI include increased length of stay, increased costs, increased risk of mortality, and poor long-term neurodevelopmental outcomes. Research has shown that interventions, including care bundles, have decreased the rates of CLABSI, but the variability in these bundles make it challenging to determine which components of the care bundles are the most effective. In the United States of America, the incidence of CLABSI decreased by 50% in the decade prior to the publication of this article. There is, however, a lack of good quality data from lower middle income countries regarding the use of effective care bundles. In Aga Khan University Hospital in Pakistan, the NICU increased in size from 12 to 24 beds, and there was an increase in the use of central lines and CLABSI rates of 17 per 1,000 device days. Therefore, the team at Aga Khan University Hospital introduced a quality improvement initiative to address rising CLABSI rates. The aim of this study then was to test the effectiveness of a CLABSI Prevention Package as a quality improvement intervention in Aga Khan Hospital using evidence-proven interventions that can be feasibly and effectively implemented in lower middle income countries. We now move on to the methods section of the article, where the authors explain how they gathered their data. You can find this on the second page of the article, right after the introduction. The authors reviewed the literature for proven interventions to reduce central line-associated bloodstream infections in the neonatal intensive care unit. 5 components were selected based on their level of evidence and feasibility in lower middle income countries, such as hand hygiene, central line insertion, central line maintenance, organism-specific prevention for fungal infections, and nurse empowerment. For further detailed breakdown of the CLABSI Prevention Package, see Table 1 on page 2 of the article. All neonates admitted to AKUH NICU with central lines were included in the study. The authors used the Center for Disease Control and Prevention, or CDC's definition of CLABSI, as a laboratory-confirmed bloodstream infection where central line or umbilical catheter was in place for more than 2 calendar days on the date of the event, with day of device placement being on day 1, and the line was also in place on the date of the event or the day before. The study followed a 3-phase quality improvement intervention design at pre-implementation for 12 months, implementation of the CLABSI Prevention Package for 3 months, and post-implementation 12 months. Data were collected at each of the 3 phases on a predefined data collection sheet and included demographic, anthropometric, laboratory, and outcome-related data. Patient days, device days, line utilization, and CLABSI rates were also collected over the 3 phases. In this study, central lines were categorized as umbilical venous catheters, umbilical arterial catheters, peripherally inserted central catheters, otherwise known as PICC lines, and central venous catheters. Moving on to the analysis and results, which can be found on the 3rd page of the article. Descriptive analysis described all relevant variables. The primary outcome of the intervention was the rate of CLABSI. The rate of CLABSI was described pre- and post-intervention. Risk factors for CLABSI were identified through a linear model. This is a statistical test where all possible risk factors are entered into a model and the factors with the highest ratio are identified, taking all other factors into account. The author sought to describe the device utilization ratio, the CLABSI-related mortality rate, and microorganism profile. So what were the results? A total of 2,642 neonates were admitted to NICU within the study period, of which 613 of these neonates had central lines. This totaled up to 3,995 device days and 14,867 patient days. The Quality Improvement Project successfully decreased CLABSI rates from 17.1 per thousand device days to 5 per thousand device days. Device utilization ratio declined from 0.3 to 0.25. Neonates with CLABSI had longer stays in NICU, with an average length of stay of 17.7 days, compared to those who didn't develop CLABSI at 11.9 days. The average day when CLABSI was confirmed was device day 7. There was 69% reduction in CLABSI after the implementation of the intervention in phase 2 and 3. CLABSI due to gram-negative organisms peaked on the 3rd device day, gram-positive organism CLABSIs peaked on day 5, and fungal CLABSIs on day 7. Of the neonates that died during the study period, 14.4% had central line associated bloodstream infections. The incidence of babies that died in the CLABSI group was higher than those in the non-CLABSI group, 44% versus 21%. The highest risk factor for CLABSI was prematurity with the gestational age less than 27 weeks. Which brings us to the conclusion. CLABSI rates, device utilization, and fungal infections were reduced in a resource-limited setting by using a care bundle which consisted of hand hygiene, aseptic central line insertion techniques, central line care, targeted fluconazole prophylaxis, and nurse empowerment. What are the implications for practice and policy? Nurses in lower middle income countries should be empowered to minimize central line associated bloodstream infections in neonates in their unit by following the same or similar prevention packages. We've come to the end of the video, and so now you need to access the article. The link is in the description box below, or maybe you already have a printed copy. We really encourage you to read the article in full, recognizing the parts that we have just summarized for you. After you have done that, consider the reflective questions here on this slide. If you are watching with colleagues, discuss your answers between you. Following that, take a moment to think about what you have learned and how you could apply it to improve nursing practice in your setting.